we have two. Yeah.
Yeah.
Do you want him up here as well, or no?
We'll pull him up when it's time.
Great, all right. Tell me when.
Well, do it whenever you
Okay,
are. sir.
great, awesome. So welcome, and thank you for coming today. From the beginning of the COVID-19 pandemic, Southeast Health has been on the forefront of battling this deadly virus. We've continued to have plans in place to take care of those we serve. Because of our attention to detail and planning for this vaccine, Southeast Health was among the first group of hospitals selected by the Alabama Department of Public Health to receive the vaccine. We received our first shipment this morning of 1,950 Pfizer COVID vaccines. It is currently being stored in our ultra-cold freezer. We'll begin administering these vaccines tomorrow, December 15th. We have finalized plans to vaccinate not only hospital frontline staff who are at the highest risk of exposure, but also to other exposure risk frontline workers in the community. And while we realize the initial doses of the vaccine will not be enough to cover all frontline healthcare workers, we will continue to work with the Alabama Department of Public Health to further coordinate vaccinating healthcare workers as the more doses become available. Our goal is to ensure that our frontline healthcare workers who are at the highest risk for exposure can be effectively and efficiently vaccinated as soon as possible to protect not only those employees but also their patients. With the initial limits of the amount of vaccine to be received, it will likely be sometime in 2021 before the vaccine is available to the general public. Anyone with questions can go to www.adph.org and search the COVID-19 vaccine page. Thank you.
Y'all have any questions for Taylor?
I have a question. You said that not every healthcare worker in the area will be able to get a vaccine. How are y'all selecting those who get it first?
Yeah, so the selection of those who receive the vaccine is actually coming at the direction of ADPH. That is not a Southeast Health direction. So we will take the direction out of our initial doses of 1,950, 50% come to Southeast Health, 15% each will be allocated to EMS and outside physicians, and then 20% are to other hospitals in the area. But again, who receives those allocations is actually come at the direction of the Alabama Department of Public Health.
What direction have they given?
The allotment of those vaccines go to those organizations to that percent, and that those organizations are responsible for prioritizing their allotment. Yes.
This may not be a question you can answer, but have you heard from or spoken to any of the staff in the Southeast that will be receiving the vaccination and how they were feeling about it?
Yes. So we did survey our staff to see those that are interested, and over 35% of our staff are interested in receiving the vaccination, and they're excited if they're interested. Yeah.
How many did you say were available again? I'm sorry.
1,950 are available. We received this morning.
Tell me about the storage of this vaccine. I know that this is one that needs to be stored in quite cold temperatures. Tell me a little bit about that.
Yeah, so the Pfizer COVID vaccination is an ultra-cold vaccination that has to be stored anywhere between -60 and -80 degrees. So we have very strict handling administration guidelines that we must follow. So we do have an ultra-cold freezer here that allows for the storage of that vaccine. And we have very short time frames from the thawing of the vaccination to the time it can be stored and administered. Yes.
This may be a better question for one of the doctors who's here, but there's been a lot of talk about what life is going to look like for recipients of the vaccine between the first dose and the second dose. Do you know anything maybe to talk a little more specifics of what that's going to look like, or would that be a question for one of the doctors?
Yeah, so Dr. Ravi Nalamathu, he's our medical director of our hospital's medicine department, can come up here and actually answer the question.
Could you state the question again, I think?
Yes. So there's been a lot of talk about, and I've read quite a few articles about what life for vaccine recipients might, or what rules and regulations they may need to follow between doses 1 and 2, since we know that it is a 2-part vaccine. But I feel like there's been a lot of misinformation about that. So if you could talk a little bit about, maybe what you've learned so far for what those recipients need to do between the first dose and the second dose to ensure, maximum security and whatnot.
Sure. The key thing is to understand that the efficacy of the vaccine is only present after taking both doses of the vaccination. Now, after the first dose of the vaccine, after 12 days, studies found that some degree of protection stops, but it is not complete. It's about 50% protection, but it's about 7 days after your second dose of vaccination where the study showed that 94% efficacy to prevent COVID-19 infection. So for anyone who is taking the vaccine, they should make sure that they are following their safety precautions like as if they were not vaccinated until 7 days after their second dose of vaccination. Still follow the safety guidelines like wearing masks, hand washing, maintaining social distancing until those 7 days after the second dose.
As more doses become available to healthcare workers, would Southeast Health be requiring all of its healthcare workers to be vaccinated?
Yeah, no, COVID vaccination will not be a mandate, so we will not require. It will be available to those who want it. Yeah. Also, in addition to Dr. Nalmathi's response, the CDC and Pfizer actually make available what's called the emergency use authorization, which is the vaccination information sheet, so that for those that are interested in the vaccination can receive or read more about the actual vaccination and the side effects that have come along with the clinical trials.
I do have another question. So obviously we know that the healthcare workers here and residents and whatnot will be the first to receive the vaccine. For those that will be receiving it, will they be able to, schedule time with the hospital to receive the second dosage? Will that be on them to, call and make that appointment, or will it be put once they receive the first dose?
Yeah, so once the recipient is getting their first dose, we will actually at the time schedule their second dose. For Pfizer, that is 3 weeks later. So for Moderna, I believe it is 4 weeks. So depending on the vaccination, we will actually schedule their second dose at the time of getting the first dose.
Where would that be done?
So the actual COVID vaccine clinic will be done on the second floor of our doctor's building here on site.
Is there any word about when you might be receiving doses from Moderna? I know obviously you received the Pfizer doses today, but any word on that?
Not at this time.
Okay.
Before being distributed, there has to be a process that they must follow similar to Pfizer, in which it's a multi-step process of approval for emergency use authorization.
How do you feel about getting to this step moving forward in this crisis?
I'm sorry, can you repeat the question?
How do you feel about getting to this step in the process, getting to where y'all finally have vaccines to...
I believe it's huge advancements in the medical community, period. It's great here that Southeast Health were able to provide that for not only our frontline workers here at Southeast Health, but also for the community. It's been a lot of planning, a lot of last-minute details to react to, but I have faith in this community, faith in this organization that will continue to serve to protect those.
Will the vaccine be warmed up at all before it's administered, or is it going to be a really, really cold shot?
No, the vaccine actually will be thawed and at room temperature by the time you administer the vaccine.
Okay.
Yeah.
Do
Good
you have
question.
any type of side effects possible?
Ma'am?
Any type of side effects? Have you heard any?
Yeah, but all the side effects are listed in what's called the emergency use authorization. If you go out and search the internet for Pfizer COVID vaccination and side effects, it'll be listed, but it is the normal side effects that would be expected with the vaccine.
Does Southeast have any idea, looking ahead, how this is going to impact the number of COVID patients that you have been seeing since the pandemic began? Do you think, will it significantly lower it, especially once it becomes more available?
I would think so. That's what we are hoping, but it's probably going to take a while before we get there. because since we are only now immunizing the healthcare workers, we may not see a big impact for next few weeks. But as the general public starts getting vaccinated, particularly the nursing home residents and all, we are hoping that will bring the curve down. And certainly in few months down the line, if most of the general public is vaccinated, that's probably will be our last stages of our pandemic.
Well, people who have been vaccinated, have received both doses of the vaccine, waited that 7 days, be required to follow the same protocols as they have been at the
Yeah,
hospital?
absolutely. All protocols will still be followed with mask, social distancing, and hand washing in order to continue to protect until more information is known about the vaccination, but absolutely.
Will y'all be tracking the effectiveness of this vaccine within your workers?
Yeah, there are certain things that we're required to track, including side effects and adverse outcomes or adverse events that we're also required to track. So yes, that'll be a part of the process for vaccinations.
Who will y'all report that information to?
So we had actually reported to the CDC as required, and then the state's immunization record.
I am all set.
All righty. Did it?
No.